No, great explanation. And we're seeing, photobiomodulation, the word gets promoted for everything from skin health to muscle recovery and even bone health. But, what would you say are the key evidence-backed benefits that actually are? And what would you say is like the top benefits that come from photobiomodulation?
So I think its anti-inflammatory effects are the words consistently across all the areas of its application is its effect on inflammation. In terms of disease areas, so there are around 600 or 700 musculoskeletal pain studies. So that's sprains and strains in creaky joints, so tendinopathies, joint pain, back and neck pain. There's also about 700 randomized controlled clinical trials in and around the oral cavity. So that's dentistry, oral medicine, maxillofacial conditions. A subset of that is probably one of the areas where it probably got the most work. If I was to tell you there's 20-something studies on tendinopathies, there's 54 in treating one of the side effects of radiation and chemotherapy. So that's oral mucositis. So that's side effects that you get in your mouth. The tissues begin to break down due to the stress or the radiation and the chemotherapy. They get infected, they develop ulceration, and there's different grades of it, basically 0 through to 4. If you've got grade 4 oral mucositis, then you can't eat, drink, or swallow anything, not even your own spit. It is awful. And so it's very painful, horrible quality of life, and you have to be fed by tube. So either through your nasogastric tube insertion and or you get straight into your gut. You can't eat real food. And photobiomodulation, properly applied, will reduce the incidence and severity of oral mucositis. Certainly shifts it down the grades. You can almost eliminate grade 4 oral mucositis, and you will certainly reduce the number of people that get grade 3 significantly as well. So they mostly end up at grade 1 and 2, and so and that's tolerable. I mean, it's just a little bit painful, and most people are able to eat and drink liquids and even some solid food at that level. So that's 54 randomized trials. Then, by the way, and just keep in mind, that shows you that if you can treat something that prevents those kind of conditions, it tells you how powerful the anti-inflammatory effects are of this treatment. So musculoskeletal pain was a lot of work. There are around about 100 rather small, relatively low quality studies on treating the brain. There's not much on, there's almost, no, I can't think of any controlled clinical trials on humans for spinal cord injuries. Macular degeneration, so that's an area which I have a vested interest in. So obviously, the way you've introduced me is I'm founder CEO of Thor, so I'm obviously have a bias in favor of my company in this field. But I'm also a co-founder of another photobiomodulation company called Lumithera, where we developed a device specifically for treating the eyes. The leading cause of blindness in the developed world is dry age-related macular degeneration, which is considered untreatable. You do have a treatable form, which is called the wet age-related macular degeneration, but the dry form is considered untreatable. Most people with AMD have got the dry form. It's untreatable. They are going to mostly be blind within 10 years. There's no proven treatment for it, but we've actually now got our FDA approval in the United States. We've got a procedure code, which you need for doing hospital treatments, and a reimbursement code, which means in America, people will start getting paid for their treatments. So that is really 3 out of the 7 main steps to mainstream medicine. You think, well, there's only 3? What are the 7 that take you all the way there? You need an FDA approval, so they got that. So FDA, they got procedure code, they got reimbursement code. Sorry, that is 3. There is you've got to get into clinical care guidelines as well, so that's being recommended to the doctors. Better still, you really want it taught in medical schools for it to be fully adopted. I'm now trying to remember what the other 2 are that get you there. Clinical care guidelines taught in medical schools, that one there. Oh, you need, and even that isn't a guarantee that your medical device is actually going to get routinely used. you need champions. Champions are the word that we use to describe the characters in the institutions like the National Health Service here in the UK, but it happens in America as well. You get people who say, I've read about this photobiomodulation treatment for this disease that we have in our wards of our hospitals here today. Why aren't we using it? And there'll be some bureaucratic reason why. And these people will break down the barriers within their own institution to make sure this thing gets introduced to patients. So that's a sixth critical step to it all. I've forgotten. I did once work out there were 7 things you need to get right. And so that's what that's just what I've been learning since 2017, is trying to understand why were we stuck in the doldrums where there was no FDA approvals for this treatment, there were no specific medical CE marks for it, and then what if you like, I hate to say this word, what is the business of medicine understanding? And I shouldn't say the business. What's the regulatory roadmap for these things? So that's what I've been studying more, as well as my obsession with, as you highlighted. I love the whole research on dose rate effects. That's a major area of interest. Mechanisms of action as well. But I've had to become an expert in regulatory compliance as well.
We'll come on to the dose effect because that's really important. I think we should talk about that. Just reading that back a little bit, is there a common underlying mechanism that explains why it can influence so many different tissues in the body and why it has this profound effect?
Yeah, there's 3 really. Everybody hears about the mechanism to do with mitochondria. So the hypothesis there is that it increases oxygen consumption, and the way that it does that is it activates an enzyme in the mitochondria. So hopefully everybody's heard enough now. Maybe even at school probably learned, mitochondria, they're the powerhouse of the cell. Yes, you may not realize there's hundreds and thousands in every single cell of the body. Their job ultimately is to process, well, everybody will probably learn about glucose and glycolysis and the production of pyruvate, and pyruvate is taken up by the mitochondria, first through the Krebs cycle, and then NADH, FADH hand over electrons on the electron transport chain. And the terminal enzyme of that chain is cytochrome C oxidase. And it's if you can imagine, it would be like electrons moving in this chain of protein complexes, and they have to get to the end, and they have to make it off the last one. It'd be like imagining a game. I remember I used to play Prince of Persia when I was into gaming, and just moving from one thing to other, got to get these electrons down, and then the last thing they got to be taken away by oxygen at the end. So the reason we breathe is in order to get the electron transport to move, because the oxygen gets into our lungs, gets handed to hemoglobin. Hemoglobin carries oxygen around the body, delivers it to every cell, delivers it to every mitochondria, and then the oxygen has to take the electrons off of the electron transport chain, and they basically move along. And in that process, those who've studied mitochondria will have learned about the intermembrane, the matrix and the intermembrane space, and pumping hydrogen ions, and they drive ATP synthase. So that's the last step in the process of making the energy currency, the cellular energy currency, ATP. I know I got nerdy in there. Don't worry, don't switch off. It's going to come back to something normal. But basically, the energy currency of the cell, called ATP, is accelerated by this process by which the process of making energy is accelerated by the light. The light is absorbed in cytochrome C oxidase, and it enables this process. And it doesn't just increase the production of energy. What it also does very well is it reduces the production of reactive oxygen species, which are the underlying cause of what doctors call oxidative stress and what normal people call free radicals. They are what lead to inflammation. So you're getting 2 things. You're getting more energy, and you're reducing the underlying cause of free radical production, which is what's behind all the inflammation in the body. And it's very good at basically improving the efficiency of the mitochondria so they make fewer reactive oxygen species, which you do need in small quantities. So it's not a bad thing. They're very important signaling molecules. But anyway, it seems to regulate the efficiency of the mitochondria. You make less inflammation as a consequence. You make more energy as a consequence. That's a good thing for your general cellular function and function. And then that's one mechanism. The other two is it seems to improve cell membrane permeability. So things which are important to get in and out of the cell are doing that. They exchange more readily, like calcium ions, for example, coming in and out. So that seems to be more efficient. And then also you get better blood flow as well. So if the cells are exchanging lots of little molecules inside and out of them, and there's got more available energy to use, and they're less inflammatory, and there's more blood flow going to the area, then that's going to be good for your general health, whether you be injured or not. Because some interesting things discovered are that, and we didn't know this in the early days. In the early days, it looked like photobiomodulation in the laboratory on cells only worked on stress cells. And that looked like a good thing. Good. If the cell isn't stressed, it doesn't do anything, and therefore it has no effect. And that's what it appeared to be until somebody said, well, let's put some light on some healthy cells. Look, it doesn't appear to do anything. Now let's kill them. Let's go and put some methanol in there. Let's bombard them with X-rays or LPS. Let's see what damage we can do here. And we have a group of cells which have been treated with this light and cells that haven't been treated with the light, and the ones that were not treated with the light would die at a much faster rate than the ones that didn't. So now we know that cells are somehow using this light to turn on some sort of protective qualities that makes them more resilient. And so if I take the story back to oral mucositis in cancer patients, and I said that we are preventing or we're reducing the incidence and severity of oral mucositis, we treat in cancer patients in the NHS. We are treating patients to prevent. They have our treatment before they have the radiation and the chemotherapy, and it prevents it or reduces the incidence and severity of it. So,
really important point.
Yeah.
Yeah, I was going to say a really important point you're making there is the red light therapy and PEMF therapy is super effective at repairing those damaged cells. So it's not always the case of people getting huge effects that are generally healthy. But we're looking at a preventative method a lot of the time. So, some people will be super optimized and they'll start using red light therapy or PEMF therapy. And they're like, okay, well, I haven't taken off today. I'm not flying, why is this not making that much difference? But, we want to use these as preventative methods as well as when people are super sick and they've got unhealthy cells, and as a way of regenerating and making new healthier cells. So and people that are listening to this podcast quite frequently, they might be having a bit of deja vu here because there's a lot of overlap when it comes to red light and PEMF therapy, and in terms of the benefits and how it works on the body, and why we're seeing a lot of people now stacking the two together and the two different coming at it from two different angles, and actually that being quite a synergistic effect. From your angle, who are you seeing using red light or photobiomodulation more these days? Who do you think are benefiting the most from it? And who are you seeing investing in this technology the most? Is it like athletes, or are you looking at mainly people that are chronically sick? It's a bit of a difficult question because of it. Obviously, it involves all of those markets. But where do you think you're seeing the most people using and benefiting from photobiomodulation?
So the categories break down into anybody treating pain, whether it be the pain of oral mucositis or musculoskeletal pain, people using it for neuropathic pain as well. So that's very much hospitals and professional medical clinics using it. There's a whole area of being used in sport, so people using it to recover, people using it before they exercise in order to reduce fatigue while they're doing their exercise. So those are two things, and there's quite clear evidence that if you use this treatment, you can also be maybe training harder, closer to a competition as well. So if you've got a match that you're coming up to, that you might think you have to dial back so you're not fatigued going into the day of the games. But with this, you should be able to train harder up to the last minute, fully recover from that. And so that's another area. Military is all part of that as well. Military readiness is a thing. So that's quite a big area for us, at least as big as in sport. And then there are obviously wellness clinics, so that people who don't have their own photobiomodulation or red light therapy systems can actually go and get treatments at resorts. And so that's quite a big area for us. And then there is the personal use of them as well. So that is for people who can afford our kind of equipment, which is obviously, the £100,000 plus equipment. It's for those kind of people who've got that kind of money, then that's another big area for us too. So that's still, if you like, the same as the health and longevity resorts and clinics using it professionally. Then there are a lot of people who've got enough money to actually buy it for themselves as well.